Whether you're a weekend warrior or a baby boomer, knee replacement surgery is likely in your future or maybe already has been. Some 600,000 Americans have a knee replaced each year, and that number is expected to rise to 2 million a year in just 5 years. 1 out of 5 patients has to undergo revisions, but a new procedure that personalizes the surgery for each patient is changing that. And a South Bend doctor was the first in Indiana to perform this state-of-the-art surgery. When you see the Notre Dame football team run out of the tunnel, or the Irish baseball team rounding the bases,
we'll win the game!
The head of orthopedic sports medicine for those teams is never far away. He's in his office with everyday patients who often suffer the same injuries, needing the same surgery as athletes.
You're pointing in the right direction. Toes are still forward. We like that.
Timmy Lightbird of Granger was among his first patients for what is called the Mako robotic arm assisted total knee surgery. Always athletic, Timmy was also always in pain.
So osteoarthritis had broken down the cartilage, but mostly over most of my life was pain and swelling. And so the last round was 8 years of swelling that we couldn't deal with, no matter whether we did injections, whether we drained it.
So she found Dr. Brian Radigan of Ascendant Orthopedic Alliance in Michiana.
I'm not going to just guess that you're about 3 degrees anymore.
He told Timmy how using the Mako system would personalize her needs.
So with a regular total knee, in the history, we take just a law of averages. We take patients and we kind of figure out what most people average for their alignment, degrees, and we make an implant. And then we put it in everybody with those law of averages.
More like one-stop shopping. But with the robotic-assisted surgery, Radican knows going into surgery what he is dealing with because of the preparation involved.
With the robot, we take this virtual 3D image and we can do the surgery beforehand, but we can manipulate it by just millimeters and degrees to make it fit your unique anatomy. So we don't have to go with the average size anymore. We go with their exact size and dimension.
Timmy had one knee done first, and 6 weeks later felt so good she had the other done. How has this changed your life?
Oh, it's made a world of difference. It really has. Even just inclines I couldn't do, like running across a red light, or yellow going to red, trying to get there. Couldn't run across the street. Couldn't do anything that required any impact at all.
Timmy never missed a day of physical therapy and urges others facing knee replacement surgery to consider the Mako robotic arm.
Fantastic. It's great. I'm pain-free in terms of the joint itself, and I have my full range of motion. Mostly I can do stairs without pain, which is fantastic, and my workouts are back.
And because of the precision involved, Dr. Radican believes in the long term, patients will have a better recovery and will be one and done.
It's right on with their unique anatomy. And that's what I love about it. As a sports physician, I want things to be highly functional.
Do you think this is going to become the gold standard?
I think it should be. I mean, in my opinion, it should be. Because nowadays the game's millimeters and degrees. It's the same surgery, just a little more specific. So why wouldn't you want that?
For Timmy, she can't imagine.
It's made a world of difference for me. Being able to work out again is fantastic.
Wonder about insurance? The good news is many insurance companies will cover Stryker's Mako robotic arm surgery. It can also be used on hips. And to find out more about the procedure, just go to our website and click on this story.